A lot of our clients ask me about the differences between various helping modalities. So, for those who don't know, can you explain the difference between counseling and therapy?
Yes, I can definitely go into that. So I think the first thing I'll probably start out with is that they're very interchangeable a lot of the time, but there are distinct differences in terms of the focus, the scope, the application. So counseling, their focus and scope is usually tends to address specific issues or situations, such as career guidance, relationship problems, or specific stressors, often focusing on providing solutions to current problems and developing strategies for coping. The duration is usually short term, aiming to assist individuals in overcoming immediate concerns. The approach counselors usually take with helping clients to identify goals and potential solutions to problems, which usually cause emotional turmoil. And they usually seek to improve communication or coping skills, strengthen their self esteem, promote behavioral change, and optimal health. Their qualifications for counselors are usually a master's degree in counseling or a related field, or they're licensed independently in their state. So therapy, or aka psychotherapy, the focus scope is usually more long term. They're usually diving into deeper traumas, past traumas, issues, chronic patterns. The aim is to explore the root cause of major issues like depression, anxiety, or personality disorders. Therapy is more concerned with restructuring the personality or self and dealing with long-standing patterns or behaviors of thought. Duration is usually long term and ranges from several months to years, depending on the complexity of the issue. The approach therapists usually take when it comes to working with clients is to help them really understand the connection between their feelings, thoughts, and behaviors. That process usually is looking at exploring past experiences and how it affects current behavior with the aim of doing deep personal change work. The qualifications for therapists usually are a master's degree, doctoral in psychology, clinical social work, marriage and family counseling, psychiatry, and they have to be licensed in their state. So there are key similarities. They both provide a support environment where clients can talk about openly with objective, neutral, non-judgmental space. Both approaches to me aim to improve mental health and well-being and enhancing the self and understanding of the problems that may be affecting their belief system. So when choosing, another thing I probably want to point out is, how do I choose therapy or counseling? It really depends on the nature of your issue. And thinking about what's your specific problem, the type of guidance that you actually need. So if you're looking to look into deep work regarding your what you may find the patterns that are problematic that maybe stem from childhood, you might want to look at psychotherapy as more long term. Counseling is more goal oriented and short term. Well, it should be.
Well, thank you. I love that definition that you gave and all of those distinctions because people tend to have a lot of questions about those. In my years as a coach, I have referred clients to therapists when they need those services.